Now, the Gauteng Department of Health is carrying out planned electrical infrastructure repairs at Steve Biko Academic Hospital in Pretoria today. The work, scheduled from morning till afternoon, is affecting levels 8 and 9, which house obstetrics, gynaecology, neonatal and paediatric services. High-risk patients have been moved to a safer area, while 33 elective surgeries have been rescheduled. For the latest on the repairs and the impact on hospital services, we cross live to SABC News reporter Nomvuyo Ntanjana at Steve Biko Academic Hospital in Pretoria. How are things going so far? Is it getting any better?
Well, good afternoon to you, Tabiso, and to the SABC viewers at home. Indeed, we are at Steve Biko Academic Hospital in Pretoria, where the Gauteng Department of Health is basically updating or upgrading the electrical infrastructure here at the hospital. We understand that the work is done in drips and drabs, and it's a work that started last year in September after a team of experts, we are told, identified areas that needed upgrade or that need upgrades. As I'm speaking to you, I am standing in ward, or a maternity ward rather, and if I'm going to ask my colleague to pan to his right or left, where he will be showing you that the area is currently dark, and what we are being told is that half of the patients from this ward were moved to different levels to allow the operation to be concluded for today. However, I want to bring into conversation Gauteng Health spokesperson Steve Mabona. Earlier, you were saying again that this work is done in drips and drabs.
Yes, definitely. We are doing it in phases because we don't want to interrupt the entire facility. So that's why we focus on levels. We are doing 2 levels, which you have your obstetric and gynecology, paediatric, and you also have an element of those that would be in, medicine unit. It's not a number of, not many of them, when you're looking at those that are impacted. But we felt that let's use this opportunity because we know that if we don't fix this, we're going to be having a challenge where the problem might be dire. So we had to then make sure that the switches are replaced so that in the event of any power outage, we are in a position to have a seamless process of making sure that the generators kick in and they give us power and we are not interrupted. So that's what we are doing basically. And we can see that the works are continuing. The electricians are working. They are well afoot. They did confirm to us that they are still on schedule. We are looking at switching on around 1 o'clock, and we are hopeful that that will happen in due course.
Steve, how critical was the situation here in terms of the challenges before you decided to mitigate?
Look, the critical, it's when you are, you have outage and your breakers don't switch on and you must do it manual. So that lapse in time, it becomes a challenge because you would not know what impact that might have. If I were to make an example, if theaters are on, they are busy working, so you risk endangering people's lives if you were to prolong this process. So that's why we felt that we can't prolong the process. We need to make sure that we attend to it and finalize. Hence, we felt that at least if it's going to inconvenience us for 2 to 4 hours, let's rather then accommodate those that are high risk, which doctors have already identified and said these ones need to be moved to areas where there won't be any disruption when coming to the dependency on ventilation, oxygen that they need. So those who are comforted that they are safe, and those that are stable, then they will be in the wards, which are dark, but because we are doing this thing during the day, natural light also assists us to avoid the darkness.
I'm going to have to interrupt you there, as I am being told that the studio needs to go to Ramaphosa. But however, as a spokesperson, a Gauteng Health spokesperson there, Steve Mabona, has indicated that the operation is ongoing. However, there are no interruptions in terms of where patients are concerned, as they have been moved to other levels. However, for now, back to you in studio.